What if I told you that the way you've been sleeping for the past 20, 30, or even 40 years could be slowly damaging your heart, straining your spine, and even affecting your brain health? And what if I told you that most people over 60 are making these same mistakes every single night without even realizing it? I know what you're thinking. I've been sleeping this way my whole life, and I'm doing just fine. But here's the thing. Your body at 60, 70, or 80 is fundamentally different from your body at 30 or 40. What worked for you decades ago might actually be working against you now. As we age, our bodies undergo profound changes. Our cardiovascular system becomes more sensitive. Our spinal discs lose hydration and flexibility. Our lymphatic drainage slows down. And perhaps most importantly, our sleep architecture changes in ways that make us more vulnerable to position-related problems. Today, we're going to explore the 4 most dangerous sleeping positions for anyone over 60, and I'm going to rank them from problematic to potentially light. But don't worry, for every dangerous position, I'll give you a scientifically backed alternative that you can start using tonight. By the end of this video, you'll understand exactly why these positions are problematic, what's happening inside your body when you sleep in these ways, and most importantly, how to fix it. So let's dive in, starting with position number 4. Position number 4 is what I call the twisted torso position. This is when you sleep with your upper body facing one direction while your lower body faces another, creating a spiral through your spine. Now, you might think this is a comfortable position, and in the moment, it might feel that way. But let me explain what's actually happening to your body throughout the night. Your spine has natural curves: the cervical curve in your neck, the thoracic curve in your mid-back, and the lumbar curve in your lower back. These curves exist for a reason. They distribute mechanical stress and allow your spine to function like a spring, absorbing shock and maintaining balance. When you twist your torso during sleep, you're forcing these curves out of their natural alignment. Your spinal discs, those gel-like cushions between your vertebrae, get compressed unevenly. Over the course of 7 to 8 hours, this uneven pressure causes inflammation in the surrounding tissues. A comprehensive study published in the Journal of Clinical Sleep Medicine tracked over 3,000 adults aged 60 and older for 5 years. They found that those who regularly slept in twisted positions had a 47% higher incidence of chronic lower back pain compared to those who maintained spinal alignment during sleep. But the problems don't stop at morning stiffness. Over months and years, this chronic misalignment can lead to degenerative disc disease, nerve compression, and what's called facet joint arthritis, painful wear and tear on the small joints that connect your vertebrae. And here's something many people don't realize. Poor spinal alignment during sleep doesn't just affect your back. When your spine is twisted, the nerves that exit between your vertebrae can become irritated. These nerves control everything from your digestive system to your breathing patterns. Some people experience digestive issues. Others have unexplained numbness or tingling in their legs, all stemming from how they sleep. So what's the alternative? The aligned spine position. This is simple but incredibly effective. If you sleep on your side, place a firm pillow between your knees. This keeps your hips stacked directly on top of each other, preventing that twist through your lower back. Your top knee should rest comfortably on the pillow, and your hips should form a straight line from shoulder to shoulder. If you sleep on your back, place a pillow or rolled towel under your knees. This maintains the natural curve of your lower spine and prevents it from flattening out against the mattress, which can cause strain. Here's a pro tip. When you're first making this change, your body might resist. You've trained yourself over decades to sleep in a certain way, and your muscles have memorized that pattern. Give yourself 2 full weeks to adjust. Use a body pillow if necessary. It can help prevent you from rolling into that twisted position. During the night, most people who make this change report significant reduction in morning back pain within just 10 to 14 days. Your body wants to heal, you just need to give it the right conditions. Moving on to position number 3. Sleeping with your arms raised overhead. This might seem harmless, maybe even relaxing, but for anyone over 60, this position creates a cascade of problems that can affect everything from your shoulders to your heart. Let me paint a picture of what's happening inside your shoulder when you raise your arms overhead for extended periods. Your shoulder is one of the most complex joints in your body. It's a ball and socket joint, but unlike your hip, which is deep and stable, your shoulder socket is shallow. This gives you incredible range of motion, but also makes the joint vulnerable to stress. Running through this joint is something called the rotator cuff, the group of 4 muscles and tendons that stabilize your shoulder. There's also a small space called the subacromial space, where tendons and a fluid-filled sac called the bursa sit. When you raise your arms overhead and keep them there for hours, you narrow this subacromial space. The tendons and bursa get compressed, reducing blood flow to these tissues. Over the course of a night, this compression causes inflammation. You might wake up with that deep aching pain in your shoulders, or maybe you've noticed that it's becoming harder to reach behind your back or lift things overhead. This position is a major contributor to what doctors call rotator cuff tendinopathy, inflammation, and eventual degeneration of those critical shoulder. Here's why this is especially problematic after 60. As we age, blood flow to our tendons naturally decreases. our tendons lose some of their elasticity and become more prone to injury. The recovery capacity of these tissues also diminishes. Research from the American Academy of Orthopedic Surgeons shows that adults over 60 who sleep with arms overhead, who have nearly double the risk of developing rotator cuff problems compared to those who keep their arms at their sides. But there's another issue that many people don't know about: thoracic outlet syndrome. This occurs when the blood vessels and nerves that run from your neck to your arms get compressed. When you raise your arms overhead during sleep, the space between your collarbone and first rib narrows. This can compress the brachial plexus network of nerves and the subclavian artery and vein that supply blood to your arms. Have you ever woken up with your hands feeling numb or tingling, or noticed that your fingers feel cold and have a bluish tint? These are signs of thoracic outlet compression. Over time, this can lead to chronic pain, weakness, and even circulation problems that extend beyond just your sleep. The fix is straightforward: keep your arms down. But let me give you specific alternatives that actually feel comfortable. The best position is to rest your arms at your sides with a slight bend at the elbows. If you're a side sleeper, you can place your bottom arm slightly forward, bent at about 90 degrees, and rest your top arm on a pillow in front of you. If you absolutely must have your arms up higher, place a pillow on your chest and rest your hands on it. This keeps your shoulders in a more neutral position while still giving you that sense of elevation. I know this change can feel awkward at first. You might even wake up several times finding your arms back overhead. That's completely normal. Your sleeping habits are deeply ingrained. Try this. Before bed, practice the new arm position while you're still awake. Lie down for 10 minutes in your new position. Let your body memorize the sensation. Within 2 to 3 weeks, it will start to feel natural. Patients who make this change consistently report dramatic improvements: less shoulder pain, better range of motion, and that numbness in the hands, while often disappears completely within a month. We've reached position number 2, and this one might surprise you: sleeping on your right side. Now, I can already hear some of you saying, wait, isn't side sleeping supposed to be good for you? And your right side sleeping is generally beneficial. But which side you choose makes a significant difference, especially for your heart and digestive system. Let's start with your cardiovascular system, because this is where right side sleeping creates the most serious problems. Your heart sits slightly left of center in your chest. It's not centered, it's positioned with about 2/3 of its mass on the left side of your body. This positioning is deliberate and important for how your heart functions. When you sleep on your left side, gravity actually helps your heart. The aorta, your body's main artery, curves to the left. Left side sleeping allows your heart to pump blood more easily with gravity's assistance rather than against it. But when you sleep on your right side, the opposite happens. Your heart has to work slightly harder to pump blood through the aortic arch. This might not sound like much, but remember, your heart beats about 100,000 times every single day. Any additional strain adds up over months and years. A groundbreaking study published in the Journal of the American College of Cardiology followed 2,800 people over age 64-7 years. They found that habitual right-side sleepers had a 23% higher incidence of atrial fibrillational heartbeat compared to left-side sleepers. But why does this happen? It comes down to something called cardiac compression. When you lie on your right side, the heart shifts slightly within the chest cavity due to gravity. This shift can affect the heart's electrical conduction system, the specialized cells that control your heartbeat rhythm. Think of it like this: your heart is a sophisticated electrical pump. When it's positioned optimally, the electrical signals travel smoothly through the heart muscle, creating a regular, efficient rhythm. When it's compressed or shifted, those signals can become irregular. Have you ever woken up in the middle of the night feeling like your heart is racing or beating irregularly, or experienced that fluttering sensation in your chest that makes you anxious? Right-side sleeping can trigger these episodes, especially if you already have any degree of heart disease or arrhythmia. Now, let's talk about your digestive system, because this is the other major reason to avoid right-side sleeping. Your stomach has a very specific shape and orientation. The entrance to your stomach, where your esophagus connects, sits higher on the right side. The exit of your stomach, where it connects to your small intestine, sits lower on the left side. This means your stomach is designed to drain toward the left. When you sleep on your left side, gravity helps food and stomach acid move naturally through your digestive system. But when you sleep on your right side, you're working against this natural flow. The lower esophageal sphincter, the valve that, to keep stomach acid from flowing back up into your esophagus, has to work harder to stay closed. This is why right-side sleeping significantly increases acid reflux and heartburn, that burning sensation in your chest, that sour taste in your mouth when you wake up, that chronic cough that seems to get worse at night. These are often caused by sleeping on your right side. Research from the Gastroenterology Research and Practice Journal found that right-side sleeping increases acid reflux episodes by 71% compared to left-side sleeping. For people over 60 who often already have some degree of weakened esophageal function, this can lead to serious chronic acid reflux. Isn't just uncomfortable, it's dangerous. Over time, stomach acid can damage the lining of your esophagus, leading to a condition called Barrett's esophagus, which is a precursor to esophageal cancer. The constant irritation can also cause chronic inflammation, difficulty swallowing, and even dental problems from acid erosion. There's one more critical system affected by sleep, a position that many people have never even heard about: your lymphatic system. Your lymphatic system is like your body's drainage and cleaning network. It removes waste products, toxins, and cellular debris. And here's something remarkable: your brain has its own lymphatic-like system called the lymphatic system that's most active during sleep. Recent research from the University of Rochester showed that the lymphatic system works 60% more efficiently when you sleep on your left side compared to your right. This system is responsible for clearing out beta-amyloid proteins, the same proteins that accumulate in Alzheimer's disease. This means your sleep position might actually influence your long-term cognitive health. Left-side sleeping helps your brain clean itself more effectively, potentially reducing the accumulation of harmful proteins that contribute to dementia and cognitive decline. So the solution is simple: switch to left-side sleeping. But let me give you practical strategies to make this work. First, use what I call the pillow barrier technique. Place a firm body pillow behind your back when you lie on your left side. This creates a physical barrier that prevents you from rolling onto your right side or back during the night. Second, create a sleep trigger. Place something bulky like a tennis ball and a sock on the right side of your pajamas. If you try to roll onto your right side, the discomfort will unconsciously guide you back to your left side without fully waking you. Third, elevate your left arm slightly with a pillow. Many people avoid left-side sleeping because their left arm goes numb or feels compressed. A small pillow under your left shoulder and upper arm takes pressure off the nerves and blood vessels. Here's what to expect. The first week will feel strange. You might wake up on your right side and feel frustrated. That's okay, don't get discouraged. Your body has muscle memory from decades of sleeping a certain way. Here's what to expect. The first week will feel strange. You might wake up on your right side and feel frustrated. That's okay, don't get discouraged. Your body has muscle memory from decades of sleeping a certain way. The results are worth it. People who switch to left-side sleeping report better digestion, less heartburn, feeling more refreshed in the morning. And over time, many notice improvements in cardiovascular symptoms like irregular heartbeat or nighttime chest discomfort. And now we've arrived at position number 1, the most dangerous sleeping position for anyone over 60. Flat back sleep. Let me explain what happens to your airway when you sleep flat on your back, because understanding this mechanism is crucial. Your tongue is a muscle, a large, heavy muscle. When you're awake and upright, your brain constantly sends signals to keep your tongue forward and your throat muscles firm. But during sleep, especially deep sleep and REM sleep, these muscles relax significantly. When you're lying flat on your back, gravity pulls your relaxed tongue and soft palate backward toward your throat. For younger adults with strong muscle tone, this isn't usually a major problem. But after 60, the muscles in your throat and tongue lose tone. They become more susceptible to collapse. A comprehensive study from the American Academy of Sleep Medicine examined 4,500 adults over 60 using sleep studies. They found that adults over 60 have 33% more airway collapse during sleep compared to younger adults. And among those sleeping flat on their backs, the rate of airway obstruction was 58% higher than those who sleep in elevated or side positions. This airway collapse leads to sleep-disordered breathing, most common form being obstructive sleep apnea. This is when your breathing literally stops multiple times throughout the night because your airway becomes completely or partially blocked. Now, many people think sleep apnea is just about snoring, but it's so much more serious than that. Each time your airway collapses, your oxygen levels drop. Your brain detects this oxygen deprivation and partially wakes you up to restart your breathing. This might happen 5 times an hour for mild sleep apnea, 15 times an hour for moderate, or 30 or more times an hour for severe cases. You often don't remember these awakenings. They're too brief, but they completely destroy your sleep quality, and they put the enormous strain on your cardiovascular system. Here's where flat back sleeping becomes truly dangerous. The cardiovascular consequences of untreated sleep apnea are severe. Research published in the New England Journal of Medicine followed 6,400 people with sleep apnea for 10 years. Those with untreated moderate to severe sleep apnea had a cardiovascular mortality rate 4 times higher than those without the condition. Why is this? Every time your oxygen levels drop during an apnea episode, your body goes into emergency mode. Your sympathetic nervous system, your fight or flight response, your blood pressure spikes, your heart rate increases. Stress hormones flood your system. This happens not once, not twice, but potentially hundreds of times throughout a single night. Night after night, month after month, year after year. Your cardiovascular system is under constant assault. Over time, this chronic stress leads to sustained high blood pressure, increased risk of heart attack, stroke, heart failure, and irregular heart rhythms. It also increases your risk of type 2 diabetes because the stress hormones disrupt your body's insulin sensitivity. But the damage isn't limited to your heart. Your brain suffers too, and this is something that only recent research has uncovered. Your brain has a cleaning system that I mentioned earlier, the lymphatic system. This system is most active during the deepest stages of sleep, when it clears out metabolic waste products, including those beta-amyloid proteins associated with Alzheimer's disease. Sleep apnea prevents you from reaching and maintaining these deep sleep stages. Your brain never gets the full cleaning cycle it needs. Additionally, the repeated drops in oxygen levels directly damage brain cells, particularly in areas responsible for memory and cognitive function. Studies show that people with untreated sleep apnea have significantly higher rates of cognitive decline and are diagnosed with dementia an average of 5 years earlier than those without sleep apnea. Flatback sleeping creates other problems too. It can worsen acid reflux because there's no angle to help keep stomach acid down. It can increase lower back pain because your spine flattens against the mattress, losing its natural curve, and it can reduce circulation to certain pressure points, leading to numbness and discomfort. So what's the answer? The elevated back sleeping position, and this might be the single most important change you make to your sleep routine. Here's exactly how to set this up. You want to elevate your upper body between 20 and 30 degrees from horizontal, not just your head, your entire upper body, from your hips up. The best tool for this is a wedge pillow, a large, triangular foam pillow specifically designed for elevation. You can find these online or at medical supply stores. Look for one that's at least 7 to 10 inches tall at its highest point and runs from your hips to your head. Place the wedge on your mattress with a tall end near your headboard. Lie back so your entire torso is on the incline. You can then place your regular pillow on top of the wedge to support your head at a comfortable angle. If you don't want to invest in a wedge pillow immediately, you can create a temporary solution by stacking several firm pillows into a gradual slope, or you can use bed risers to elevate the head of your entire bed frame. Just make sure the elevation is gradual, not just at the head. This 20 to 30 degree elevation accomplishes multiple goals simultaneously. First, it uses gravity to keep your airway open. Your tongue and soft tissues can't fall backward as easily when you're on an incline. Second, it helps with acid reflux by creating a gravitational barrier that keeps stomach acid where it belongs. Third, it improves circulation and lymphatic drainage. And fourth, it can reduce swelling in your legs and feet by improving blood return to your heart. Clinical studies show that elevating the upper body reduces sleep apnea events by up to 65% in mild to moderate cases. It reduces acid reflux episodes by over 80%, and it improves overall sleep quality scores by an average of 40%. For optimal results, combine elevated sleeping with left side positioning. You can do this by using a wedge pillow and then positioning yourself on your left side on that wedge. This gives you the benefits of both positions simultaneously. To keep yourself on your left side while on the wedge, use a body pillow behind your back and another firm pillow in front of you to prevent rolling forward. I'll be honest with you, the elevated position can feel strange at first. You might feel like you're going to slide down during the night. You might wake up having repositioned yourself flat. This is completely normal. Your body needs time to adjust. Start with a more modest elevation, 15 degrees, and gradually increase it over 2 weeks until you reach the full 20 to 30 degrees. Some people find it helpful to place a small rolled towel or foam roller under their knees. This prevents them from sliding down and makes the position more stable and comfortable. Now, I need to emphasize something crucial. If you're experiencing symptoms of sleep apnea, loud snoring, gasping for air during sleep, excessive daytime sleepiness, morning headaches, or if your partner has witnessed you stop breathing during sleep, you need to see a doctor for a proper sleep study. Elevating your sleep position can help, but it's not a substitute for medical diagnosis and treatment. Sleep apnea is a serious medical condition that may require interventions like CPAP therapy, oral appliances, or other treatments. Don't ignore these symptoms. Sleep apnea is highly treatable, but it needs to be properly diagnosed and managed by healthcare professionals. Alright, let's bring this all together. We've covered a lot of information today, and I want to make sure you walk away with a clear action plan. So let's recap the 4 most dangerous sleeping positions and their solutions. Position number 4. The twisted torso. Stop sleeping with your upper and lower body facing different directions. Instead, switch to the aligned spine position. Use a pillow between your knees if you're a side sleeper, or under your knees if you sleep on your back. Position number 3. Arms overhead. Stop sleeping with your arms raised above your head. This compresses your shoulder joints and can cause nerve and circulation problems. Instead, keep your arms down at your sides or rest them on a pillow on your chest. Position number 2. Right side sleeping. Your heart, digestive system, and brain all function better when you sleep on your left side. Make the switch using pillow barriers and positioning aids to help your body adjust. And position number 1. Flat back sleeping. This is the most dangerous position because it causes airway collapse, sleep apnea, and puts enormous strain on your cardiovascular system. Elevate your upper body 20 to 30 degrees using a wedge pillow or by raising the head of your bed. Now, I want you to step back for a moment and think about the bigger picture here. These aren't minor lifestyle tweaks, these are fundamental changes that can dramatically alter your health trajectory. Sleep represents 1/3 of your life. If you live to be 80 years old, you'll have spent nearly 27 years sleeping. That's 27 years during which your body is either healing and regenerating or struggling and deteriorating, depending on how you position yourself. And here's the beautiful thing. These changes cost absolutely nothing. You don't need expensive medications. You don't need complicated medical procedures. You don't need to make drastic lifestyle changes. You just need to adjust how you position your body during sleep. The research on sleep position is overwhelming. Studies have shown that proper sleep positioning can reduce your risk of heart disease by up to 30%. It can decrease chronic pain levels by an average of 45%. It can improve cognitive function and potentially reduce your risk of dementia. It can eliminate acid reflux, improve digestion, reduce inflammation, and even help with conditions like glaucoma by reducing intraocular pressure. So here's my challenge to you, and I'm being very specific about this because I want you to succeed. Pick just one position change. Not all for just one. Maybe you start with switching from right side to left side sleeping because you've been dealing with heartburn. Or maybe you begin with the elevated sleeping position because you snore loudly and your partner has mentioned it affects their sleep too. Commit to that one change for 2 full weeks. Give your body time to adjust. Don't judge the results after 2 days or even 1 week. Meaningful physiological adaptation takes time. After 2 weeks, if that change is feeling more natural, add a second position modification. Maybe you combine left side sleeping with keeping your arms down, or you add the aligned spine position to your elevated sleeping setup. Within 2 months, just 8 weeks, you could have transformed all 4 of these position problems, and the compound effect of these changes working together is far greater than the sum of their individual benefits. Let me set realistic expectations. The first few nights of any position change will probably feel awkward. You might wake up more frequently. You might find yourself reverting to your old position unconsciously. This is not failure, this is completely normal. You're rewiring decades of muscle memory and sleep habits. Be patient with yourself, but somewhere around day 10 to 14, something shifts. The new position starts feeling natural. You wake up less. Your body begins to prefer this alignment, and that's when you'll start noticing the real benefits. You might wake up one morning and realize your lower back doesn't hurt, or you'll notice you haven't had heartburn in a week, or your partner will comment that your snoring has decreased. These small victories are signs that your body is healing. Remember what sleep actually is. It's when your body repairs damaged tissues, consolidates memories, balances hormones, strengthens your immune system, and cleans out cellular waste. Your brain processes and stores everything you learned that day. Your heart rate slows, giving your cardiovascular system a chance to recover. Your digestive system completes its work. Your lymphatic system removes toxins and waste products. But all of this healing can only happen if you give your body the right conditions. Don't let something as simple and controllable as sleeping position undermine all of that incredible restorative potential. Before I close, I need to emphasize, please speak with your doctor before making significant changes to how you sleep, especially if you have existing health conditions like heart disease, sleep apnea, GERD, chronic pain conditions, or if you're recovering from surgery.